I would like to begin this video by letting you guys know that we are already at 26% for the 100 likes that we need to get to release the MIP21 Medical Interpretation Practice video, the new season. We're trying to get the video titled Prepare for the CCHI to 100 likes. That way we can go ahead and release that video for YouTube. So get on that, guys. We still share and like. We still have, how much is that, 74 likes to go. So we are a little bit over a quarter of the way there, and I know we can do it. I'm gonna post a link in the description, and I'll probably put a little card up here reminding you, so that way you can go to the video, share that video. Let's get that video to 100 likes, and let's get that video posted on YouTube. Another thing that we want to do is, whenever we post that video on YouTube, we want to see what you think about it. We want to hear all of your comments. We'll probably let people comment on that for about a week or two, and then after that we are just going to randomly pick out 2 of the people that are commenting on that video, and we are going to give them special links to the medical interpretation practice video MIP22, which they will get a chance to record and send the answers to us. That way we can provide them feedback. So we are really excited about this, and we hope that you guys are excited as well. So let's see that video get 100 likes. So that is it for that. And hello and welcome to Unwind Sessions, where right after my shift I give the highlights of my workday and answer any questions that might have been asked at a previous session. My name is Juan. I'm an English, Spanish, medical video remote consecutive interpreter with over 4 years of experience. Today is Tuesday, July 27, 2021, and I took a total of 31 sessions today. Like always, it was a mix between video and audio sessions. There was a particular audio session which lasted about a little bit over an hour. I have a highlight for that session as well, and I have a couple of highlights today. Well, actually 3 highlights today. So let's get to it. The first highlight is something that I've been wanting to mention for probably about a week, a little bit more, a little bit less, I'm not so sure, but it is something that I've noticed ever since I made the Rozan note-taking video. There was an example where it says, like, to add emphasis on a word, like if you have a note where it says really quiet. If it's quiet, you just write down quiet, right? But if it's really quiet, then you put an underline under the word quiet to provide emphasis, and that'll make you remember that it's really quiet, right? Or if they say extremely quiet, then you put 2 little lines. And I have integrated that into my notes because, of course, it's very easy to do, and it really does save a lot of time. It's not something that you're going to use every day, because it's not every day that people talk like that with really emphasis on adjectives or on words using adjectives, right? But it is a lifesaver whenever you use it. And of course, 1 line to remember that it's like emphasis, or 2 lines to remember that it's really, there's a lot of emphasis, is really a lifesaver, and something that I have incorporated into my notes from the Rozan Method, and I wanted to remind you of this. And your note-taking is something that, for me, I think is something that you're never going to get right. You're going to have to perfect it along your life, but along your lifetime, but you will never get the 100% method proven to help you get the best notes in the world. I don't think that is possible. I think this is something that you just need to work on, and you have to have that mindset that you always have to find and figuring out ways to better the notes. Like, for example, you can read the Rozan Method, and maybe you're not going to use everything from that method, but whatever you use, trust me, it'll be good and it'll make your notes better. So you have to constantly be looking for strategies, for methods, for whatever, just new stuff. And I don't do this anymore. I do this every once in a while now, but when I barely started, I remember I would go through every note-taking video I could find on YouTube, and that really helped me to improve my notes. But I am still constantly improving my notes, and this is a task that is never gonna end. So don't feel bad if you don't have good notes just yet. Just know that this is a process that you're never gonna get 100%, and you are always going to improve, and there's always room to improve. All right, so moving on to the second highlight, it was the session that I told you. It was a video session which was a breathing test, and the difficult part here in this session is that the provider, well, it was a time test. The provider had to tell the patient when the patient needed to take in a deep breath and when the patient needed to exhale, right? And what made it difficult is that when the lady gave the instructions, I gave the instructions right after, and there's like a little bit of a delay, but the computer was on a timer. So if there was a little bit of a delay, the test would stop. So now you can see how big of a problem this created, right? How were we going to get over this bump to be able to get this test in the right conditions, right? So now the first thing that was suggested was to actually just ask the lady how she wanted to do this because of that delay, and that delay was explained to her, and she didn't really like give us an answer. She said whatever was fine. So it was up to me because the provider wasn't really giving any ideas. So I had to take matter into my own hands. I had to step out of the interpreter role, and I had to figure out something. Since I was like the language expert, right, the language bridge, I had to figure out something. So of course, like the first thing that I tried is I tried explaining to the lady that whenever the old lady said breathe in, that meant inhale, and when she said breathe out, that meant exhale. And the lady said okay, but in practice everything just fell apart, and the lady was not taking the cues right. And then the lady suggested that maybe the provider should clap whenever the lady needed to breathe in, and then clap whenever she needed to exhale. But the provider was making sure that everything was working well, and she had her hands full, literally. So she couldn't clap, right? She had both of her hands full, so she couldn't clap. So that was ruled out. There was no way that we could do this. And the way that it worked, the lady, the patient, actually suggested that she should just scream. Like whatever she wanted to say. Of course, the provider, whenever she said, she screamed breathe in, then the lady knew that that was her cue to breathe in, and when she said breathe out, that was her cue to breathe out. But she didn't really care about what words were said. She just needed to hear her screaming. So then when they were doing the test, the provider just went breathe in, and the lady knew exactly that she needed to breathe in, and then she said breathe out. So she knew that she was waiting for the screaming cue to be able to do the task. So that was a little bit difficult, but finally we were able to figure out. And of course the lady was the one that gave us what she thought would work the best, and that's what worked the best. I just wanted to mention this because this was something out of the ordinary. I had never been asked to do this, and you might probably get asked to do some weird things just to make sure that you can communicate and get through sessions. And the last highlight today is a new word for me, and that word is Insulinoma. The Spanish translation for that is just the same, Insulinoma. And the definition from healthline.com for insulinoma is a small tumor in the pancreas that produces an excess amount of insulin. In most cases, the tumor isn't cancerous. Most insulinomas are less than 2 centimeters in diameter. Now, this session was from a gentleman that his sugar was dropping so much, like he was drinking gallons of milk to be able to keep up his blood sugar. Like, you could imagine the problems this gentleman had, and he ended up in the hospital for low blood sugar. The doctors suspected it was this because they saw something in his pancreas, but they were not sure about it, and they had to do some more tests. But they didn't let the gentleman go home because they were scared that his insulin might drop so far that he could potentially die. So this is a very rare condition that was mentioned, and I was surprised to actually hear it. I had never heard about it, like many things I hear in this job, right? But I don't know, that just seemed like very crazy. It's usually diabetes, right? Why people will get into trouble, but insulinoma, lots of insulin and low blood sugar. So that, I believe that is way more dangerous than diabetes, right? Because diabetes, you have most of the time is high blood sugar. Of course, there is hypoglycemia, which is low blood sugar as well, but that doesn't happen as often as high blood sugar. But with this, like, the danger for low blood sugar is there, like it's just there. So something curious. All right, so now the reason that you are here, the 10 common medical conditions. The following definitions are from healthline.com, mayoclinic.org, niddk.nih.gov, and aaai.org. All right, and today this is going to be a little different because I was hesitant about giving the Spanish translation because I didn't want this videos to get flagged as English Spanish only, right? Because I'm giving you the definition and I wanted to leave it without a translation. That way it can work for all languages. But I mean, I'm giving you the definition, and I mean, it's only gonna take like a little bit more time just giving you the translation, right? So I thought, yeah, why not? I'm gonna include it. It was suggested by one of our viewers, so thank you for that. And yeah, why not? I mean, I'm gonna help you guys a little bit more, right? At least the Spanish speakers. So great idea, and the rest of the vocabulary sessions are going to be just like this. Okay, so for the first term is hypertension. The Spanish translation you can see right here is almost the same, hipertensión, just a little bit of words and an accent there that change, but it's almost the same. Now, hypertension is high blood pressure. Now, hypertension is a common condition in which the long-term force of the blood against your artery walls is high enough that it may eventually cause health problems, such as heart disease. Now, there is a lot of people that have high blood pressure. I know that my grandpa had high blood pressure. I know my grandma has high blood pressure. I know a lot of people that are older that have to take medications for this. So this is a very common condition and one that you should be aware of. And most of the time the providers will not say hypertension. They will say high blood pressure, but they do use hypertension as well. So if it ever comes up, you will be ready and you will already know what that is. Now, number 2, hyperlipidemia, or right here, hyperlipidemia, and in Spanish, hyperlipidemia. There we go. Should be focusing, right? Hyperlipidemia. And now, hyperlipidemia is just high cholesterol. It's abnormally high levels of fats, lipids in the blood. Now, 2 major types of lipids found in the blood are triglycerides and cholesterol. Now, this is a very common condition as well. I mean, there is a problem of obesity in the world, right? So it is not something that's surprising, and it is like one of those things that you have to know. And I don't think I've ever heard any medical providers call it hyperlipidemia or hyperlipidemia. I have only heard high cholesterol, but I wanted to include the correct medical term in case you ever happen to come across it, you will be ready. All right, and term number 3, diabetes. Now, the Spanish translation for it is just the same. It's spelled the same, diabetes, diabetes. So you guys are ready on that one. That was an easy one. And diabetes is a disease that occurs when your blood glucose, also called blood sugar, is too high. Blood glucose is your main source of energy and comes from the food you eat. Insulin, a hormone made by the pancreas, helps glucose from food get into your cells to be used for energy. Sometimes your body doesn't make enough or any insulin or doesn't use insulin well. Glucose stays in your blood and doesn't reach your cells. So also diabetes, because of like I don't know what to say, the industries that are poisoning us with all of their sugar and all of that really good tasting food, right, that we shouldn't be eating. Well, that is causing us, the whole world, all those diseases: hypertension, hyperlipidemia, and diabetes. So those are like the 3 major ones. For sure, in one day you are going to get one of those 3 conditions, and it is good that you actually know what they are and the target, the the translation for your target language, because those 3 are like common. If you don't get a session about it, you will definitely be asked at least one of those words several times in a day. So very important. Number 4 is back pain. Right here you can see in Spanish, dolor de espalda. And back pain is one of the most common reasons people go to the doctor or miss work, and is a leading cause of disability worldwide. Now, this is not like big definition, right? I'm pretty sure everyone can say back pain in their own language and you're not going to struggle with it, but I just wanted to include it here because this is like the top 10 reasons why people go to the doctor. So it was there and I wanted to include it. I could have included something else, but I thought, no, just to give people an idea that they are going to see things related to back pain. So it might be a good idea to study up on the vocabulary for back pain, right? Okay, and number 5, anxiety. Ansiedad, right there in Spanish. And anxiety, where is it? Oh, here it is. Anxiety is your body's natural response to stress. It's a feeling of fear or apprehension about what's to come. The first day of school, going to a job interview, or giving a speech may cause most people to feel fearful and nervous. Now, for some reason, I didn't know what anxiety was until I became an interpreter. Now, because I haven't felt it, but because I just didn't know that that was anxiety. It was brought to my attention by a co-worker that said that she got really anxious whenever she was fumbling to find the correct word during a session. And I said, whoa, I mean, that's exactly what I feel as well. So I guess that must be anxiety. So yes, I felt anxiety, and I just had a very bad, it wasn't like clinically bad, but it was bad as far as anxiety goes in my life. With school, last semester, at the end of the semester, I had like I just thought the world was caving in on me and I wasn't gonna get through all the classes and everything, but everything went good. So yeah, anxiety, that is one of the major reasons why people go to the doctor as well. So remember that you have to know the definition and the translation to your target language for that as well. And number 6, obesity, and the Spanish translation is obesidad. We can see that right there, so it's almost the same, pretty easy. And obesity is a complex disease involving an excessive amount of body fat. Obesity isn't just a cosmetic concern, it is a medical problem that increases your risk of other diseases and health problems such as heart disease, diabetes, high blood pressure, and certain cancers. Well, I didn't mention certain cancers, but definitely high blood pressure and diabetes are there, and also high cholesterol. Well, it's not on there on the definition, but it is, you can get high cholesterol from obesity, and that is a problem that we can see in the world. So definitely this is like one of those things that doctors don't really like to talk about because they don't want to offend the other party or feel rude or anything. So whenever this subject gets talked about in sessions, they like try to be as nice as possible, and some people just get mad. I mean, who wants to get called fat, right? So, I mean, this is like a very touchy subject, but it is a subject that is gonna come up. I mean, come on, it's a really big problem in the world. All right, so number 7, allergic rhinitis, allergica. You can see it right there. I don't know if it's focusing correctly. There it is. And the definition for this is: an allergen is an otherwise harmless substance that causes an allergic reaction. Allergic rhinitis or hay fever is an allergic response to specific allergens. Pollen is the most common allergen in seasonal allergic rhinitis. These are allergy symptoms that occur with the change of the seasons. Now, fortunately for me, I've never suffered allergies in my life. I think I've only had one allergic reaction. I don't know what it was for, just a rash a couple of days, and that was that. So I wouldn't know anything about this, but I definitely with the changes in weather get a lot of sessions about allergies and stuff, and people confusing allergies with colds and stuff like that. So definitely must. I have never heard it called allergic rhinitis though, but it's nice to know. I have had to interpret the word rhinitis though, not allergic rhinitis, but rhinitis, and definitely is one of those terms that you will have to know. All right, and number 8. Oh, number 8 is a mouthful. Number 8 is gastroesophageal. Oh, where is it? Okay. I don't know if I can focus it. Okay. Gastroesophageal reflux disease, also known as GERD. And the Spanish translation for this is enfermedad de reflujo esofágico. So it's pretty similar. But the definition for that is a digestive disorder that occurs when acidic stomach juices or food and fluids back up from the stomach into the esophagus. GERD affects people of all ages, from infants to older adults. Now, this is a very common disease as well, and most of the time, the providers will never say gastroesophageal reflux disease. They'll just be like GERD, and you have to remember the translation for that. And honestly, I have to think about this one for a while. It's not something like, not for a while, but it's not something that is instant. Like in my mind, to be able to interpret whenever they say GERD, I have to remember gastroesophageal reflux disease, and then I have to translate it into Spanish. So for me, this translation is a little bit difficult, but it's something that I know, and I don't ever get stuck on it, but it does take me a while to actually translate GERD to enfermedad de reflujo gastroesofágico, right? But I think it would be easier if they just say gastroesophageal reflux disease, but who wants to say that, right? So, okay, number 9, respiratory problems, problemas respiratorios, and this is the same as the back pain. I'm pretty sure everyone knows how to say respiratory problems in their language, but I wanted to include this, that way you guys know that there is going to be like a plethora of things that can go wrong with the respiratory or the airways, with the respiratory tract. And you guys are going to need to be familiar with all of those terms. The definition for this is allergies, asthma, inflammation, or infections are just some of the conditions that can cause you to have breathing problems. The right diagnosis and treatment, along with better understanding of your condition, can help you manage your breathing problems. So that just gave you a little bit, but there is so much more stuff that can cause breathing problems. So it'll be a good idea to actually go and look into those causes. That way you don't get surprised whenever you have to interpret those terms, right? All right, and for number 10, I can't focus, damn it. Okay, hypothyroidism, and in Spanish it's there, hypothyroidismo. There it is, hypothyroidism and hypothyroidismo in Spanish. The definition for this is the underactive thyroid is a condition in which your thyroid gland doesn't produce enough of certain crucial hormones. So the thyroid does not produce hormones that the body needs to work correctly, right? So they have to give the patients some sort of hormone replacement. That way their body can function normally, and that is very, very, very common as well. Hypothyroidism and hyperthyroidism is another condition like this, is quite opposite, and those are conditions that you are going to need to get familiar with as a medical interpreter. So that is going to be it for today's vocabulary, guys. Remember to please leave your questions in the comments, and I will answer some of them on the next session. If you need me to answer something that is time sensitive, please let me know in the comments. That way I can hurry up and make a video as soon as possible and not put it in the queue of the rest of the videos. Remember that I'll be here every Monday through Friday after work, and also remember that we are trying to get the video titled "Prepare for the CCHI" to 100 likes. If we get that video to 100 likes, we are going to be releasing the first episode for the Patreon only new season of MIP, Medical Interpretation Practice. So let's get to it, and then once we get to release that video, we are going to let you comment on that video. That way we are going to pick one of those people that commented randomly, and 2 people actually, and we are going to give them an exclusive preview to MIP 22, and they are going to get the chance to be able to record their answers and send them over to us. That way we can have a look at them and give them some feedback. So let's get on that, guys. Let's get to that video to 100 likes. We are already 1/4 of the way. I know that we can do it. Another thing that I want to mention, remember that we have a Patreon page where with as little as just $1 of your support, you help to motivate us to create much more content, and we give you access to everything on that page. You get medical practice videos ad-free, you get scripts to those videos, answer sheets to those videos, vocabulary lists consisting of 50 words each vocabulary list, and much more content. But the most important thing is that you win a special place inside of our heart. Special shout out to all of our patrons. We love you guys, and to all of our subscribers as well. That is it. Thank you so much for watching. Please like and subscribe if you liked the video for more content, and don't forget to share. Happy interpreting. Goodbye. Goodbye.